Hello, everyone. I'm Kelsey Romeo-Stuppy, Managing Attorney at Action on Smoking and Health. I'm joined today by Martin Raw, who's the Director for the International Center for Tobacco Cessation and a visiting professor at New York University's School of Global Public Health. We're coming to you live today to discuss an article that we co-authored along with several other colleagues, Dr. Carolyn Dressler, Dr. Cheryl Hilton, Dr. Harry Lando, and ASH's own Chris Bostic and Laurent Hubert. One of the reasons that we wanted to write this article was to draw attention to cessation as a human rights issue, not just as a tobacco control or a public health issue. But I think before we dive into those arguments, it's really important to understand some basics about cessation. Martin, can you describe what makes a successful cessation program and why cessation programs are important?
Yeah, sure. When we talk about a cessation program at national level, in an ideal world, we're talking about a country where all tobacco users who need help to stop have access to that help. Again, in an ideal world, this would mean that all smokers are given, in a country, are given brief advice in primary care and ideally in hospitals and other settings as well, being offered behavioral support if they need it, and that could be face-to-face or through individual support in groups, or electronic, for example, telephone helplines and text messaging. And then finally, all of that being supplemented by the offer of a stop smoking medication, free or reimbursed if they need it. This cessation support is important because many smokers need help to stop, and that's because nicotine is so addictive. It is true that some stop without support, although that is only 5% roughly in a population over 1 year. But many can't stop without help, or can only stop after many attempts, which can take many years. And of course, many never stop. And according to WHO's estimates, 8 million of those die prematurely each year because of their smoking. And this slide illustrates why cessation support is so important. Basically, it's a World Bank slide. So the top line, and this was published in 1999, shows the deaths between 2000 and 2050 on current trends, 520 million premature deaths. If we halve the proportion of young adults taking up smoking between 2000 and 2020, that goes down to 500 million premature deaths. So it's not, well, it's a large number, but it's not a huge proportion. The only way you get a very significant reduction in premature deaths is by halving adult consumption by 2020. So adult cessation is absolutely critical. And by the way, we are, of course, already at 2020. So we've already missed those estimates, which makes it even more urgent.
So how many countries around the world are doing cessation programs well?
Well, the FCTC article set out in detail what countries need to do to establish an effective cessation support system. And for the program to be effective, they do actually need to be implemented. WHO's latest Empower report, published last year, reveals that since their last report, which was 2017, so over the last 2 years, only 4 countries were added to their definition of the best level of cessation support, but 6 countries dropped out of that best level. So actually a net reduction in the countries offering best level support as they define it over the last 2 years, which is not very encouraging. Our own survey confirms this impression of disappointingly slow progress. I'll just give you a few numbers to illustrate that. Only 1/3 of countries had an official national cessation strategy. Only 1/4 had an identified budget for cessation. Only 1/4 had a national telephone helpline or specialized treatment services, and perhaps even more critically, only a third of countries required the recording of tobacco use in all medical notes. So that's a critical measure, which suggests that for many, many countries, and for the majority, this isn't really on the agenda yet.
You mentioned the FCTC, which is a treaty, so I wanted to jump in for a second and discuss the human rights side of this. To address the negative impacts that corporations have had on human rights, the UN has guiding principles on business and human rights, and those are based on 3 pillars, which is protect, respect, and remedy. And tobacco cessation falls really clearly under remedy. Governments have allowed corporations to harm the health of their citizens, and one thing they can do to help solve that is to make tobacco cessation treatment widely available. The states aren't fulfilling their obligations to protect people from the harms of tobacco, but they can help remedy those harms by providing cessation support. I also wanted to point out, and we mentioned in the article, that tobacco control and cessation don't exist in a vacuum. Helping people to quit smoking will help achieve other international goals, like the Sustainable Development Goals. So in order to meet human rights obligations under the FCTC, which has human rights implicit in it, and the goals of the right to health, countries must create the guidelines and implement them in a way that provides accessible and affordable cessation support. Martin, you led the drafting on Article 14 guidelines for the FCTC. Can you talk a little bit about the goals of those guidelines?
Yes, the FCTC Article 14 guidelines set out in some detail the components of a national support system, including core infrastructure, for example, the measure I just mentioned, health professionals giving brief advice to tobacco users to stop is a core infrastructure measure that should be implemented throughout the healthcare system. But the guidelines also strongly recommend implementing cessation support in a stepwise way and focusing on measures that are broad reach and low cost. Now, most of the measures I mentioned from our survey have a strong income gradient, meaning the higher the country's income level, the better the provision of support, which is kind of logical and logically obvious. So I think cost and concern about cost is an important factor. I say concern about cost because I do think there's a tendency for some countries, to focus on traditional treatments like telephone helplines and medicines, which can be expensive, and to underemphasize lower cost population measures like brief advice, text messaging, and a new drug, cytosine. So if I had to summarize in one sentence what countries could be doing now to improve their cessation support, it would be to implement the FCTC Article 14 guidelines.
Yeah, that's great. I wanted to jump back on something you just said. The concept of progressive realization in international law is basically what you just explained. And that's that some countries like the United States or the UK can and should afford full cessation programs right away. Whereas other countries like maybe Togo or Burundi can't afford it yet, but they can do something. And you were mentioning the Article 14 guidelines, and that's a stepping stone for them to start helping their citizens. And governments are obligated under the FCTC and under human rights treaties to do just that. So before we wrap up, did you have any further thoughts you wanted to mention?
Well, that's a good point. The FCTC itself, the only obligation in Section 14, Article 14, is that countries should develop comprehensive guidelines. And our survey data show that not even half have done that so far, 15 years later. And the other point is simply that many countries, I know that many countries think that cessation is expensive. And the point of the guidelines is it need not be.
So unfortunately, we have a long way to go. But we talk about in the article and in our real lives all the time about how human rights can help be a bridge to achieving our tobacco control goals. So please feel free to check out our article. It's called The Urgent Need for a Human Rights Approach to Improving Smoking Cessation Treatment. It can be found on BMJ's tobacco control blogs, and it's also linked from the ASH website, which is www.ash.org. Thank you so much for joining us today, Martin, and thank you so much to everyone who is listening.
Thank you.
Bye.